Hi, my name is Alexa Lua Moore, and this is my project proposal, Nurse Burnout and One Major Change to Combat Nurse Burnout. Before we get started, I wanted to share this picture. This picture was actually taken during the COVID pandemic by a photojournalist who was able to go to the hospitals, and it was released in an article called Healthcare Workers Are Exhausted, and it follows along nurses who are experiencing burnout. In fact, during the COVID pandemic, we saw about 100,000 nurses leave nursing entirely. And the study that was conducted that found these numbers is the NCSBN research, and it is considered the most comprehensive and only research in existence uncovering the alarming data that I'm about to share. In fact, the study also found that there's going to be about 600,000 or more nurses planning on leaving nursing by the year 2027. 200,000 of those nurses are under the age of 40 years old. And by the year 2025, which is this year, and this study was conducted in 2023, there's going to be a nurse shortage of about 250,000 to 400,000. And keep in mind, this nurse shortage isn't because there isn't enough nurses, it's because these nurses are tired and burnt out. What is burnt out? Burnout is a state of physical, mental, and emotional exhaustion. What causes it? Heavy patient loads, assignment task loads, poor management, inadequate resources, lack of leadership, short staffing, long hours, and complex regulations. And we're going to focus on one of those topics as well furthermore. To your left, you see here nurses striking in New York, demanding more nurses. And of course, these nurses their biggest reason for this is because they feel burnt out and they're hoping to have more nurses and more CNAs. So the background and rationale. So of course, with nurse burnout, we're going to start seeing a trickling effect, and it doesn't affect it just the nurses, but it also affects, as you could see, our patients. So when you have nurse burnout, you have unsafe patient care. Nurses suffering burnout actually have an increased risk for medication errors, patient falls, adverse events, or patient safety incidents. These patients also suffer from more frequent pressure ulcers and overall increased mortality rates. Another study that was conducted in Illinois, where they conducted between nurses who had a 4-to-1 patient ratio or higher. So that means one nurse, 4 patients, or a nurse to more patients. In fact, any nurse that had more than the 4-to-1 had a 16% higher odds of death with each patient added to their load, and each patient had a longer length of stay. Those nurses also complained of higher feelings of burnout. In fact, another study found that over 31.5% of nurses throughout the United States reported burnout, but even more of those nurses, 43.4%, identified burnout as the reason that would contribute to the decision to leaving their current job. So let's talk about the project objectives. So the project objectives is to reduce nurse burnout, providing resources and decreasing the workload by implementing lower nurse to patient ratios. I'm showing this on the left is the California RN to patient safe staff ratios. And the reason is because California is the only state with comprehensive mandated ratios. In California, you'll see that in certain floors, they have different ratios, of course. For example, in the ICU, they'll have 1 nurse to 2 patients compared to your med-surg floor that has 1 to 5. And the reason behind that is because, of course, if a patient is in intensive care, they require more time and they require, just more time and more care. And as you can see here, states with no RN to patient ratios right here. The only reason Massachusetts isn't gold is because they're one of the states that does have patient ratios, but it's only in the operating room and the ICU. So the methodology or study design, the Iowa's model of evidence-based practice is the one that I chose because it focuses on improving patient care by applying evidence-based practices to changes within the healthcare system. So of course, the topic I chose was the effects of nurse burnout and the opportunity to implement nurse to patient ratios. Of course, these are the 7 steps, including the 8th, which is to implement the change. When it comes to forming a team, so of course you want to form a team of nurse to patients, you want to retrieve evidence, you want to grade the evidence, and then you want to develop an evidence-based standard, which in this evidence-based standard would be lower nurse to patient ratios are safer for patient outcomes and happier nurses. And in this, the retrieving of the evidence and grading the evidence, Much of the studies that were conducted comparing the hospitals that had lower patient ratios, they had much more better outcomes. Pilot intervention. So, of course, you want to test the evidence-based solution on several hospitals. And in this case, I would love to see more studies taken across the United States, and not just specific hospital settings, but all type of hospital settings. So that does include your community, your county, your private hospitals, nonprofit, and such forth. And then, of course, evaluate the results and determine if the intervention was effective, and then implement the change. So you want to integrate the evidence into routine practice, which, of course, we have seen in some states. And of course, some states like that are, like I said, California. So the practice change. So the practice change is to lower or implement a federal nurse to patient ratio across hospitals in the United States in every department based on patient load of each floor. Now, as you can see here, it is cut off a little bit, but these are some of the rationales, and I'll go through the rationales. So I'll start with the second one. I'll touch base on the first one again. But the second one, when you have fewer patients, you have decreased stress levels, which lead to lower burnout rates and an improved nurse shortage. And so how does that happen? When nurses have less feelings of burnout, they're more likely to stay at the job. So again, that combats the nurse shortage. When you have fewer patients, you have better time management, you have reduced errors and less hospital-acquired infections. Again, improved safety of care for patients. Again, we have fewer patients, you have more time for each patient, and so that each patient gets an adequate, safe care improvements, and it is better outcomes. Now, the first rationale has to do when you have improved patient outcome, you have shorter hospital stays, and the hospital saves money. In fact, one study conducted in New York estimated 4,370 lives saved. And on top of that, for the hospital, $720 million saved over a 2-year study period. This is a study, and they discovered this. And so it's definitely a practice of change that should be considered. Now, implementing the plan. So let's talk about some barriers and strategies first. Now, one of the barriers that comes across is it takes time and it costs money in order to be hiring more staff. Another issue that comes about is state versus hospital timeline. So what this means is some hospitals, magnet hospitals especially, magnet hospitals are hospitals that are held by a higher standard and graded by the magnet system. Those hospitals, whether the state has these regulations or not, tend to have lower nurse to patient ratios, and they have better outcomes. The state, there's only, again, one state that has these strict legislation rules in regards to it, and it's California. And even with California, it took them approximately 5 years to implement nurse to patient ratios. So that's definitely a barrier that some places can see, because every hospital varies and their budget is different. But as you can see here, one study in Illinois is, again, back to the study that was staffed to 4-to-1 ratio during a 1-year study period. More than close to 1,600 deaths would have been avoided, and the hospital would have collectively saved over $117 million. And this study was concluded after 30 days. So they implemented this and saw these results in only 30 days. So again, it can be done. And then another quote that I wanted to share, in fact, a very powerful quote, it's the single most effective nursing reform is nursing ratios. And these ratios not only protect patients, but keep experienced RNs at the bedside. And this was from Linda Aiken. She is an RN at the Center for Health Outcomes and Policy Research. In fact, this research was conducted back in 2010, but it's still very relevant today. This nurse continues to fight for these nurse ratios, including many other nurses. In fact, we're still seeing these issues, and we see strikes that come about from nurse burnout and calling for a change. In fact, what's happening in Oregon right now is there is nurses who are currently striking because it was, I believe, let's see, it was September 1st of 2023 when Oregon was supposed to implement, or they started putting state guidelines on nurse to patient ratios, but these hospitals still haven't done so. So these nurses are on strike, and they've been on strike since January 10th, and there is still in the process of negotiations with unions with hospitals right now. So we do see that it's, still an ongoing issue even after COVID. Now, the steps to implement this plan, of course, is hire and support staff, train staff, and then enforce. Now, the methodology to evaluate would be through peer evaluations, employee satisfaction surveys, patient outcome improvements, patient satisfaction, and then outcome mapping, and then cost-effective analysis. As you know, we discussed earlier, we discussed multiple hospitals that have shared how much money they have been able to save. And with those savings, it also, can help hire more nurses. Now, of course, when we're doing these, surveys, especially with patients and with nurses and such forth, it's very important to remember patient privacy and HIPAA regulations. So definitely when implementing these, a lot of the studies, emphasize that, and they also emphasize the importance when it comes to peer evaluations of making sure that they aren't biased. Now, expected outcomes and implications of implementing nurse to ratio staffing. You're going to see reduced nurse burnout, which is, the biggest topic that I'm trying to, discuss here. And when you have those reduced nurse burnouts, you have improved patient care, you have reduced medical errors, lower mortality rates, fewer hospital-acquired infections, shorter length of stay, and enhanced patient satisfaction and cost effectiveness. Now, the conclusion is when hospitals have fewer burnout nurses, everyone wins. Burnout is created by poor work environment, heavy workload, lack of breaks, and poor management. Nurses are crying out for a change, and one change is reducing the workload by implementing lower nurse to patient ratios that could benefit nurses, patients, and hospitals overall tremendously.